Good afternoon. I would like to introduce my PhD topic, which is improving acute pancreatitis management. My name is Dorottya Tarján. I'm working as a gastroenterologist resident and a PhD student at the Division of Pancreatic Diseases. My vision is to contribute to clearer guidelines, and for that my mission is to improve the management of acute pancreatitis. To achieve these goals, I have three specific projects. The first one is identifying early predictors for infected necrosis in acute pancreatitis. The second one is investigating the safety and effectiveness of cholecystectomy in pregnant women with acute pancreatitis. And the third one is the acute pancreatitis severity prediction. It's time to use artificial intelligence. So my first project is identifying early predictors for infected necrosis in acute pancreatitis. Among patients with acute pancreatitis, 20% of the patients develop necrotizing pancreatitis. Secondary infection of the necrotic tissue is a severe condition with increased morbidity and mortality, requiring antibiotic treatment or even invasive interventions. Overall, patients with infected necrosis were more than twice as likely to die compared to patients with sterile necrosis. The risk of organ failure is 3 times higher. However, early predictors for infected necrosis allowing the initiation of an early therapy to improve the outcome have not been established yet. Therefore, our aim is to identify early predictors for infected necrosis. Hence, our clinical question is, which parameters can predict early infection in necrotizing acute pancreatitis? Our population is patients with necrotizing acute pancreatitis. For index tests, we're looking for early predictors, which can be any laboratory value, for example, CRP, white blood cell count. Our reference test is microbiologically confirmed sample, Gain-Mar EUS, or surgical intervention, or radiological signs of the infection. Our outcome is the infection, and we are looking for sensitivity and specificity. Our hypothesis is there are early predictors for infected necrosis in acute pancreatitis, and with the help of them, we can identify a specific group of patients who would benefit on early antibiotic therapy. We ran the systematic search in October with the search case you can see here at 3 databases. We got almost 8,000 articles, and after the duplicate removal and the title and abstract selection, and we also finished the full text selection, we got 18 articles. My second topic is investigating the safety and effectiveness of cholecystectomy in pregnant women with acute pancreatitis. Acute pancreatitis in pregnancy refers to acute pancreatitis that occurs during pregnancy or 3 months after the delivery. Most cases in pregnancy are mild. However, 20% of the cases will be severe. The most common cause is cholelithiasis, which accounts for more than 65% of the cases. Acute biliary pancreatitis related to pregnancy has a relatively high recurrence rate of 17% compared to the general population. Index cholecystectomy has been proved to have multiple benefits in the general population. We want you to imagine that you have a patient who you treated with a biliary pancreatitis. What would you suggest her? To have an index cholecystectomy now, or try to wait and hope for the best for the coming months? So currently in the guidelines, there are no clear answer for this question. Hence, our clinical question is to investigate the safety and effectiveness of index cholecystectomy in pregnant women. For that, our population is pregnant women with biliary acute pancreatitis. We're looking for the exposure of index cholecystectomy, and for the comparator, there are patients who didn't have index cholecystectomy. For outcome, we were looking for maternal and fetal mortality, preterm delivery, recurrence rate, severity, or the need for ERCP. Our hypothesis is that index cholecystectomy is safe and it reduces the recurrence rate of biliary acute pancreatitis. For that register analysis, I'm going to use the Hungarian Pancreatic Study Group Acute Pancreatitis Register. My third topic is acute pancreatitis severity prediction. It's time to use artificial intelligence. The clinical course of acute pancreatitis can be variable depending on the severity of the disease. For risk assessment, we have 3 options. The first one is using univariate biomarkers, which can be obesity, CRP, creatinine. These all has a dose dependence manner from the severity, but they all has a low accuracy. Therefore, their use in the clinical settings are limited. System of multivariate scores have been developed to predict the outcome by using multiple variables. However, they are usually use laboratory markers which are not available at the time of the admission. And they usually need more than 1 day to be able to fulfill them. Therefore, they results in valuable time loss. The next step is the use of the artificial intelligence. The EASY app is a recently developed web-based application which uses multiple continuous variables which are available at the time of the admission. It is able to calculate a risk score between 0 and 1 while explaining the prediction of the machine learning model. Since it doesn't require all the parameters to give us a result, it can be used at the time of the admission. Since you can write down the exact laboratory results, there is no information loss. And since it uses artificial intelligence, it is continuously improving. To summarize my projects, for the first project, I'm planning to finish in May. My second project, I plan to finish in the next year, August. And my third project is already under submission. I would like to thank you for your attention. And my quote is that hope is the thing with feathers by Emily Dickinson.
Congratulations on the presentation. It was really nice. I love your second topic because it's close to my field also. My only question would be, what's the trend in Hungary for index cholecystectomy for pregnant ladies? Because I know even for regular patients after acute pancreatitis, it's really hard to manage the index cholecystectomy. Is there a trend? Do they do it? Do they not? If you know anything.
Yes, I think in Hungary, they most likely try to wait and avoid the surgery. But in like journal articles, they suggest that we should do the index cholecystectomy because it is safe. But I think it's Hungary, the trend is more like try to wait.
Congratulations, very nice presentation, and it's very interesting for me also, mainly the second topic, because of a surgical topic. I would like to ask that, do you have any information or any data about that? What is the incidence of acute biliary pancreatitis in the pregnancy, and what is the risk these patients for without cholecystectomy for the recurrences?
For the first part of the question, that acute pancreatitis in pregnancy is a rare disease, so therefore there are not usually a guideline for this. And you can see that the incidence of pancreatitis here for pregnancy here, and for the most of the cases in European countries is biliary. But interestingly, in China, the most common cause is hypertriglyceridemia.
Okay, and why I'm asking that, because also the cholecystectomy has some risk, bile duct injury, and so on and so on. And for example, the narcosis is another thing. And I think you should do, or is there any meta-analysis about this cholecystectomy, index cholecystectomy, risk of the index cholecystectomy during pregnancy? Or because if there's no, maybe we should do.
Yes, currently no meta-analysis in this topic. So there are only like recommendations and expert opinions in this topic, but no meta-analysis. So if I have enough data, I would like to do one. Thank you for your suggestion.
In the cholecystectomy topic, can I ask whether is there any difference between the Hungarian protocol? How long do a patient have to stay in the hospital versus in another country? Because it may be make core differences, whether the length of stay in hospital
I don't think there is a big difference between the length of this stay. I think the big difference is that when the acute pancreatitis occurs during the pregnancy, which semesters, and also it's important to mention that acute pancreatitis and preeclampsia has an association between them. So if you have acute pancreatitis, you have that increased risk to have preeclampsia during the pregnancy. So it has multiple reasons to watch these patients. But it's has a 70% recurrence rate, so patients has a really high chance to go to the hospital again.